This evening, I'd like to talk a little bit about anxiety and depression. Can you outline the symptoms of anxiety?
Yes. And when a patient presents with anxiety, you can usually see it in, they have a very worried look. Their hands may be shaking. They may hyperventilate. They may have rapid speech. They may kind of look around, in an anxious manner. And they're usually very willing to express that they're feeling very anxious.
And how would you treat anxiety at this stage?
When somebody presents with anxiety, you need to find the reason for the anxiety. And there is usually a very quick way you can ask. You can say, what kind of things bother you? And don't try to pinpoint one, just have them give you a list. And as they're giving you that list, they will kind of zero in whether it is, I think I'm diagnosed with something, or I just had a test done and it may be positive, or my daughter is flying home from some distant place. You can then differentiate whether the anxiety is based on an actual event or whether it is free-floating anxiety with them being unable to pinpoint the cause for their anxiety. If it is for an anticipated event, there's not much you can do other than be very understanding and reassuring. If it is for something that has happened, it requires a very different approach.
What about the use of drugs in treating anxiety?
Usually, if you go to a general practitioner or a psychiatrist, they will immediately prescribe medications. And as most of us have seen, there are numerous anti-anxiety medications called anxiolytics, constantly advertised on the television. What people usually don't realize is when you first start to take them, the effect doesn't come in right away. It takes a while for the effect to come in. And also, most anxiety medications will cause drowsiness, sleepiness, and poor performance if you're working.
Can you outline the line between anxiety and depression?
Yes, depression is usually phase 2. If the anxiety cannot be pinpointed and addressed, people feel kind of hopeless and unable to resolve whatever it is, whether it is known to them or unknown. And depression is a far more serious problem. And as a therapist, if somebody presents with depression, one of the things you really have to ask them and be very frank about it is you ask them if they have ever considered taking their own life. If they admit to it, further follow-up is indicated immediately. If they're kind of hesitant, you can follow them closely, but it's a very difficult decision to make.
What other symptoms of depression can you identify?
Depression, early depression, can be differentiated between reactive depression or clinical depression. Reactive depression can be a reaction to a real event. So if somebody passes away, or if somebody loses a job, or loses a child, or is diagnosed with a very serious illness, you would take a look at it and realize that that's a real thing, and you would help them deal with it as much as you can. And if you cannot, medications can be given, but carefully.
What are some of the risks of medications?
Medications are usually multifaceted and can be difficult for your body to absorb, particularly if you're an older person or a very young person. It can cause problems with your kidneys, with your heart, with your circulation. Your entire activity level is usually reduced, which is not a good thing. For a clinical depression, medication is indicated, but has to be followed very, very carefully.
Some people use the term panic attack to cover anxiety or depression. There is a difference, isn't there?
Yeah, a panic attack is usually perpetuated by another panic attack. For instance, I remember a lady that had a panic attack going over a very steep bridge. And any time she came near that bridge, she'd have another panic attack. In that particular case, it was a panic attack that could be identified to that particular location. And of course, the treatment for that would be to go there with another person, and the other person be very reassuring. Doesn't have to be a physician, doesn't have to be a nurse or a doctor, just another person to kind of overcome this fear. The problem with panic attacks is one usually leads to another one, and a panic attack can be so uncomfortable that the one panic attack builds up an incredible fear in people of having another panic attack. I remember another lady complaining of panic attacks. She got them when she was on the freeway, and she actually had to pull over and get out of the car and walk around the car, take some deep breath, kind of reorient herself, get back in the car, and then could carry on.
Okay, you've talked about how a mental health professional would help to treat someone with anxiety or depression or panic attacks. Do you think a non-specially trained person like a life coach or a friend has any role?
Absolutely. And in fact, to a lot of psychological problems, a good friend or a very intuitive person can be very helpful. Number one, it doesn't cost you any money. Number two, there are people that truly care rather than, being paid by an insurance company or, paid for by the clock. It's now time for you to go, even though you feel like jumping out the window. A friend or a life coach. A life coach in particular, if somebody is rattling around, as we used to call it, trying to make decisions that could possibly lead to the wrong decision, to panic attacks, as well as a severe depression. If you have somebody to talk it over, to look at the consequences, whether it is a move or a job change or a marriage or any kind of change in your life, an intuitive person, life coaches can be extremely helpful, and this is a kind of a category of helpers that has developed in the last few years. And usually life coaches are very intuitive people, do not necessarily have either a master's degree in psychology or a PhD, or are not even social workers, but are just caring people. Are reasonable, will even at times come to your facility or to your home where you are if you need that kind of help, and kind of develop into a friend.
Okay, thank you very much.